forward to in the future, both in football and in turning the corner on this pandemic. Before we dig into today's data and other updates, we want to talk about the importance of mask wearing. First, I want to thank the vast majority of our campus community who are diligently wearing their masks. As we begin the semester, though, we're hearing from a lot of faculty, staff, students, and others who are very concerned about some students not wearing their masks. Maybe we've gotten into bad habits over the winter break. Let me be clear. Masks are required, and there can be consequences for not wearing it. Masks are required. Wear your mask. Masks are required. Dr. Greg, let's start with you. I know we've talked about this before, but remind us again why are masks so important in stopping the spread, especially now with these new variants that are circulating in the United States.
Good morning, Chancellor. It's a pleasure to be with you and the Provost again today.
Thanks.
As you know, both the CDC and the World Health Organization recommend wearing facial coverings to prevent the spread of COVID-19. Although this wasn't suggested at the onset of the pandemic, it's now clear because of the pre-symptomatic and asymptomatic transmission of the virus, masks are really necessary to help slow the spread. Also, as you've noted, with the advent of the recent virus mutations that promote even greater virus transmission, and with the matter that one of these highly transmissible strains is predicted to be the most prominent strain in the US by mid-March, the use of masks is even more imperative. In communities that have mandated mask wearing, multiple studies have shown benefits both on reducing case counts and death rates. So for those who can, there's really no excuse not to be wearing a mask in public.
Thank you. Let's go to Dr. Zomchek. What exactly are faculty and staff seeing around campus when it comes to compliance with our mask policy?
Well, good morning, Chancellor. Like Dr. Greg, I'm happy to be here this morning as well with everyone. So over the past several days, we've gotten reports from several people here about the sort of lack of compliance with our mask protocol. Let me talk about what we're hearing from our faculty in and around the classroom. So they're reporting that some students are coming into the classroom without having their masks on. Some students are letting their masks down over the course of the class meeting. And then when students are getting prepared to leave the classroom, we're also hearing that they're pulling their masks down before they're out of the room. So that's troubling to us and it's troubling to our faculty as well. Also want to tell everyone what we're hearing about behavior in Hodges Library. As we all know, Hodges Library is a kind of central convening point for our campus. It's absolutely essential to all the instructional work we do here. What we're hearing from library staff is that, especially in the evening, students are letting their masks down when they're working in groups. Special concern to me are reports that some students are actively defying our hardworking staff there when they ask them to put their masks back up. So as a result of that kind of active defiance, we've authorized the library to ask students to leave who refuse to cooperate with the instruction that they've been given. I know that we're all suffering from various kinds of fatigue, Zoom fatigue, distancing fatigue, mask fatigue, but it's so important for everyone to continue to comply with our safety protocols so that we can keep our campus community safe and importantly, our campus open. You know, if there's one thing we've learned, and this Dr. Greg has just told us, there are new strains coming up. This virus has the potential to surprise us in really unwanted ways. So students, a special appeal to you, sort of, you know, mask up whenever you're in buildings and even when you're outside.
I agree. And I just want to add to that. I have my mask. This is my mask today. I choose a different one each day. When I'm in my office and no one's in here, I don't have my mask on. When anyone comes in my office, they have theirs on, I put mine on. We have meetings in my office, just like students in study groups. We all have our masks on during the entire meeting. Sometimes I forget, I walk to my door and start out, and the person right outside my door will go, oops, get your mask. That's what we all have to do for each other. Oops, get your mask. Here, I have an extra mask. I keep them in my car, on my desk, by the door when I walk in the house. Let's just all get back in the habit. It's so important. So Dr. Zomchik, again, what should faculty, staff, or others do if they encounter students not wearing a mask when they're supposed to be?
Yeah, that's a great question. So first of all, we all should know what the requirements are for mask wearing. You've just stated them very well. And we need to model correct behavior, all of us. So as representatives of the university faculty and staff especially, we need to hold each other accountable. I mean, one of the things that you said about the person outside your office letting you know when we forget, we can all forget, but vols really look out for other vols, and we've been doing that so well. And so faculty continue to model good behavior. If you see someone without a mask, decide how to intervene. I know, Chancellor, we've talked about this before when we've both been at, say, Thompson Bowling Arena for a basketball game. We've seen ushers go up and down the aisles in the arena, and they point to someone who maybe has taken down a mask to eat something or drink something and may have forgotten to put it back up. And they simply motion to that person, and that person, most of the time, puts the mask back on. So decide when to intervene, evaluate the situation, decide how to intervene. It's always best to have a kind of tiered strategy so that you start with reminding the student about how important it is for all of us to wear the mask. If you find yourself in a situation where the student refuses to wear a face covering of some sort or another, then you need to inform the student that you're going to refer that student to our Office of Student Conduct and Community Standards. And as you said, there are consequences for students for refusing to obey or comply with, I guess, our mask protocols. So, you can find information, studentconduct.utk.edu/COVID-compliance. And if you can't remember that, go to our COVID-19 page and you'll find the way to that link right there.
Thank you. Thanks to both of you. So we all are very much aware that we want to have an on-campus experience this spring. We did so well with this in the fall, y'all. But in order to keep our on-campus experience here, we all have to do our part. So get back into the habit of wearing the mask. Everyone needs to wear the mask. It's not an option. I want everyone to remember the volunteer commitment you made at the beginning of the academic year. We're going to hold you to that. We've got to all hold each other accountable for getting through this spring and through this we hope is a last surge of the pandemic, but it's serious. So now let's switch gears and let's look at the data. We haven't gotten to do this in a while. I haven't anyway. So as of this morning, we have 96 active positive COVID-19 cases. 76 of them are students and 20 are employees. This total includes 8 new recoveries. So that's 8 numbers that moved out. There were, at the same time, 11 new active cases reported yesterday. So now we have 289 people in quarantine or self-isolation. Of those, 143 are students. Now, here's some new news. We also have 2 clusters. This is our first cluster of the semester. One was related to an off-campus gathering. I hope this is the only time I have to talk about this semester. The other was in the Sigma Kappa sorority house. This is a case where there was one positive, but because of the way Greek housing is laid out, no one was doing anything wrong, but because of the way the house is laid out, more like a private home with communal living space, the Knox County Health Department considers everyone living in the house a close contact. So they are currently quarantining. As you know, we closely follow Knox County Health Department guidelines. I also want to mention that our listing of clusters, like why do we list those clusters? It's for safety to show where cases might be connected to a specific event or location. especially if that might help others who've been at those events or locations be aware that they may need to take precautions. It does not mean students have done something wrong. We're required to list those. Sigma Kappa went into quarantine immediately and connected with contact tracing right away, exactly what we want an organization to do. For the off-campus gathering, we appreciate how quickly students responded to the contact tracing. Let's keep this up. Both of those examples. This is a virus. Take precautions. But if you get it or you're worried you could have been exposed, there's nothing to be ashamed of. We want you to report it to us. There's no reason to hide. Report it to us so we can help you. Dr. Gregg, I'm going to turn to you again. Do these numbers reflect what you're seeing at the Student Health Center? And what do you expect to see over the next few weeks?
Chancellor, the numbers you've listed, they are consistent with what we've been seeing at the Student Health Center. We've been seeing a steady increase in the number of positive cases this past week. We'd expected this with more people returning to campus, but that doesn't mean it's acceptable nor inevitable. Fortunately, campus-wide, the increase hasn't been as steep as it had been back in the start of the fall semester, which is promising, but that can rapidly change if we don't adhere to our commitments. We always follow practical health and safety guidance, especially as it pertains to mask wearing, social distancing, hand washing, and avoidance of social gathering situations where the guidance isn't being appropriately followed.
Okay, so now let's look at our metrics summary. This table shows the things that we're paying attention to help us evaluate how we're doing, if and when we need to either tighten or hopefully ease up on our temporary restrictions. We've already talked about the cases here on campus. If cases rise, our capacity for isolation housing, contact tracing, and testing turnaround will also be impacted. So that's why we watch that. We're also monitoring the cases in Knox County, which are at 37 per 100,000. So 37 cases per 100,000, that's kind of the metric that people use in this to talk about this. And that metric is down about 33% over last week. Now that's great news for our community here in Knoxville. Hospital ICU capacity is another thing we look at. It is at just 10%, trending up from 5% over last week. That's also good news. Overall capacity for adult beds remains at about 8%. We've also started our community testing program on campus. It's been underway now for about a week and a half since everybody moved back in, and we will begin reporting comprehensive results next week. We add that data set to our coronavirus monitoring page, and you'll see the 14-day positivity rate reflected in this table. Dr. Gregg, I'm coming to you again. What can you tell us about our community testing program right now?
Well, so far, we're seeing a participation rate around 66% for our residential students and a positivity rate below 1%. This is great news, and we really appreciate those who are submitting their saliva samples, but we do need more. As a reminder, we're inviting and encouraging our commuter students to participate in saliva testing this semester. And of course, all of our on-campus residents are required to participate. Just remember, the lifting of restrictions is not only dependent on improvement in our adherence to health and safety guidance. In order to feel comfortable lifting our temporary restrictions, we need to be confident in our positivity rate as well. That confidence is built upon greater participation, and presently, we need to see more of our students both on and off campus participating.
I want to reinforce what you just said there. The community testing, one thing I want to know, or I want to distinguish is community testing is the same thing as the pooled saliva testing, just to be clear about that. And it's not an option for anyone living in university housing. So 66% this first week, not adequate. Those numbers need to be up closer to 100%. So let's get on board here. Let's get back in the swing of things. Your housing contract requires you to participate. So if you have any questions about it, you need to ask somebody in the dorms so you can get in the groove of this. Everybody's being tested once a week. So I want to thank everyone who's participated so far. And I know as we get back into our routines, you will make this part of your habit. So thank you for doing that. I want to talk about vaccines now because, we're all hearing about vaccines. Every state, let me see if I can clarify. Every state has its own plan and eligibility requirements on vaccine distribution. So you might hear that friends in another state are learning one thing, while here we're being told something else. As a university and as a system, we continue to advocate for prioritizing higher education, but those decisions are ultimately taking place at the state level. For those who are eligible, we are reaching out directly to make it as easy as possible to receive a vaccination. Now, right now, that's primarily, Dr. Greg, correct me if I'm wrong, that's for older members of our community, faculty and staff, that we're trying to reach out and help them know it's their turn right now. Am I right about that?
That's correct.
So as more vaccines are made available and the eligibility expands, we will work with the state and local health officials to vaccinate our campus community. So just stand by and listen for more instructions as we learn where we are with that. I want to thank everyone for being with us today on this Big Orange Friday. It looks beautiful outside my windows. I think it's cold, but it looks beautiful. It's clear and sunny. Remember to mask up, Vols. Get your masks. I look forward to seeing you, and I look forward to being here next week when we have more news to update about our campus and COVID-19. Thanks to everyone. Have a great weekend.